Joining us on the panel is going to be our key presenter, who is Calvin Okungu, and also Florence Chege from CABI. I will introduce Florence. I'll tell us a bit about her bio. Florence Chege is an environmental expert with 36 years experience in various aspects of natural resource management, community engagement, program development, and project management. She has worked with local and national government institutions, international organizations, as well as consulted for a range of development agencies, the UN bodies, and several humanitarian organizations. Her training includes forestry science, public participation, development evaluation, and project management. She is currently supporting development and leading in the implementation of various projects at the Center for Agriculture and Bioscience International, abbreviated as CABI, which is based at its Africa Regional Office in Nairobi. Florence is leading in Kenya the implementation of a project titled Joint Crop Animal Services for Smallholder Farmers in East Africa, which is exploring One Health benefits, operations, and lessons for scaling out. The 3-year exploratory project funded by WTS and BioVision Foundation is running in Kenya and Uganda since 2022. The project is supporting local structures to reach farmers with One Health related messages, including those on animal welfare. And the CABI is collaborating with Cell Health Africa in running the joint crop livestock clinics in Baringo County. So welcome, Florence, to this panel. To kick off this panel discussion, and for the benefit of those who have joined in late, when the presentation was already going on, to you, Calvin, could you summarize to us what were the farmers' biggest animal health and welfare challenges posed by climate change that your project was able to address?
Thank you very much, Dr. Paul, once again. The challenges that came upon the livestock as a result of climate change include low access to clean drinking water. That's still a big challenge in Baringo. We tried to address quite a bit of it, and there's room for more. Then there is inadequate feed, and the feed that is available is of low nutritional quality. So the animals are subjected to poor nutrition. Then there is the risk of disease outbreak. First of all, because of the environmental factors, diseases are rampant, but then the interactions between the livestock when they travel long distances in search of water and pasture exposes them to more infections and easy spread. Then there is also physical exhaustion due to long trekking during the dry seasons. And there is also the risk of physical harm, especially during banditry or during market handling. Yeah.
Okay, thank you. You've also about several different solutions that your project was able to come up with. Which among those solutions that you have presented about, that you co-created with the community, which one would you say can be scaled up or possibly replicated easily in other areas within Kenya or even other countries that face similar climate challenges?
Yeah, thank you. There's quite a lot that can be upscaled. The first among them is the upgrading of livestock breeds, because this directly translates into improved productivity and improved income for the locals, and that can improve their livelihoods directly. But again, this one needs to be very continuously done and also closely monitored so that the benefits are accrued for a longer period of time. There's a very easy way of relapsing in upgrading. because if it is not closely monitored, you can easily go back to inbreeding of some form and get back to low breeds in the future. So there is need to develop a clear strategy for the community at every location on how to sustain upgrading and monitor the results very closely. The second one is to increase access to clean drinking water. As I mentioned, what we intervened on was very little. Looking at the vastness of Baringo, there's room for more. And this directly translates into improved health and productivity of the livestock. Then the other one is investing in commercial production of pastures and preservation, and possibly value addition on the pastures to increase the nutritional quality so that the livestock are given access to nutritious feeds. And then lastly, it is supporting animal health initiatives, both by the national government and by the county governments, because health of the livestock is primary and needs to be monitored closely. Thank you.
All right. Thank you, Calvin, for those insights. Moving on to Florence, you are coming from the One Health side, especially One Health forms a major part of CABI's work. What role would you say One Health plays in enabling such communities to address the animal health, the human health, and environmental health challenges that are brought about by climate change effects?
Thank you, Paul, and greetings to all. It's a pleasure to be here. I think maybe I should start by saying One Health approach emphasizes the interconnectedness of human, animal, and environmental health. And I'm going to give an example and experience from our ongoing project. So in the WTS and BioVision funded One Health project that Paul has mentioned, we are exploring with communities in 3 counties in Kenya, including Baringo, this interconnectedness. And the other thing we are doing is raising interest and awareness on how human practice, specifically in the crop and livestock value chains, that is from production to consumption, how the practices that we as humans do contribute to One Health issues. And then the idea is that once we've had a better understanding of this interconnectedness, then we can discuss which and how these One Health issues can be prevented through changing human behavior. If you'll allow me, I'll just mention some of the key activities that the project has been doing. We have had 2 major entry points to address the One Health issues. One of them is training communities on animal welfare and also developing a standard operating procedure on animal welfare, which can be used at the local level for all animal-related activities and also on husbandry areas. The other issue we have been doing is running the One Health Advisory Clinic. Calvin talked about the crop clinics, and we decided that on top of that, we would then bring in the animal aspects, and we are calling this a joint crop livestock advisory clinic. These clinics are operated at the village level, and they are operated by officers from veterinary, livestock production, crop production, public health, and also the environment. At the clinics, usually what happens is that farmers are given a diagnosis on pests and diseases on their crops and livestock. And then they are also given advice on how to manage those particular pests and diseases. On the side of One Health risks are assessed based on what the farmers report as their day-to-day practice in production, and then advice is given on possible prevention measures. I think just to make it be somebody to properly envision this is just to highlight some of the interrelated One Health concerns that have come up at the project level from the communities. One of them is diseases, which are spread between humans and animals, for example, like rabies. And this, of course, can be prevented through vaccination. So at the clinic, we are promoting and really raising awareness on the importance of having vaccinations made. We also have the issue of human and livestock risks to health problems linked to aflatoxin poisoning. And this comes from consumption of food with some type of mold infestation, which can be prevented through post-harvest handling and also some farming practice, but particularly on produce such as maize and groundnuts, which are commonly grown in these areas. And the last one I would like to mention, of course, is the whole issue of poor animal welfare, which leads to low immunity in animals and stress, which then predisposes them to illnesses, leading to increased use of veterinary drugs. And from what we know and from the discussions we've had with farmers, there is a bit of misuse and overuse of these veterinary drugs, and sometimes not even observing the waiting withdrawal periods. And that raises a big concern in terms of not only the antimicrobial or resistance to antibiotics, but also the increased production costs, which are related to using more drugs, which are, of course, very expensive. So I think I'll leave it there for now.
Yeah, thank you, Florence, for that elaborate response. Indeed, One Health is a growing approach, and it has really proved on several circumstances on how it can help to solve community health challenges, as well as now the welfare challenges that we are seeing of animals in these communities. Going back to you, Calvin, based on the lessons from your project, which recommendations could you give to other NGOs that wish to start or are doing similar projects, especially as far as creating sustainable and impactful interventions in such communities?
Oh, thank you very much, Dr. Paul. As I indicated in the presentation, one of the recommendations is that we need locally customized strategy development in a participatory manner with communities, so that their unique dynamics emanating from their culture and their practices and their environment are properly addressed in any intervention. But I would also like to add that it's also important to work hand in hand with other partners implementing similar or related projects, so that we are able to build synergies on our interventions. We did this because Baringo County came up with what is called the County Steering Group, which is a group managed by the county and the national government and brings together all the stakeholders intervening within the space of Baringo County. And through the sharing in that County Steering Group, we were able to tell which organization is doing something similar with the other, and then we work on how to build synergies instead of duplicating efforts all the time and doing the same thing in the same place, achieving not much difference in the results. So building synergies is very important. Thank you.
Yeah, thank you, Calvin. Going back to Florence, also related to the same question I've posed to Calvin, is Florence, I'm aware that we've already been informed that CABI is working jointly with Self Help Africa in some of these interventions. Especially you've talked about the joint crop livestock clinics where you are working together with Self Help. Based on that experience, how can NGOs work best with each other or benefit from collaborations as they are working within the same communities and sometimes with the similar goals within that community?
Yeah, thank you, Paul. I think the first thing should be to just talk about the benefits of collaboration, of change agents that are working in any particular community, because it really avoids duplication of effort and misuse of resources. Because of course, if people are addressing the same thing and going to the community with the same interventions, which are disjointed, that leads to a lot of misuse of resources. But I think it also leads to exhausting the communities and also creating confusion sometimes, particularly when the messages are different and they are talking about one issue but giving very different messages. And also the time that is spent, having the communities or the government agents in different meetings, but talking about same things and same interventions, but they're not linking up. So I think to address this, and this is what we did, and I'm just building on what Calvin has said because he's already alluded to that. For development projects, we really advocate for new projects to really undertake a stakeholder analysis. And this is where then you understand who is doing what. So you come up with a stakeholder map, understand which resources are going to what effort, so that you can then see how best to fit in your intervention without having to duplicate the efforts which are being made. And also, this is also part of the co-creation, obviously, by working very closely with the local authorities and the communities. Calvin has already talked about the county steering groups. So those are very, very important because that's another way of really understanding the priorities of the county government and the communities, and then seeing how best to plug in with the new interventions. Of course, this whole process helps to build networking, not just between the participating change agents, but also within the community. So I think it's a very important thing really to do. And we are really pleased that CABI and Self-Help Africa has managed to work together in on working on the clinics. We could have easily started a new clinic in the same community, but from the discussions we had with SHA, with Self-Help Africa, we decided why not build on what they are doing and just upgrade the clinic that they were already doing. So I think that is my point of view on this aspect. Thank you.
All right, thank you, Florence. I know this discussion is so interesting, and it's really hot, especially with the growing concerns on climate change. I know we can go on and on with the discussion, but we have come to the end of our panel discussion, and maybe just to sum it up, I have some take-home messages that I have put together for myself, which I perhaps think might be also of benefit to our participants. One is co-creation of solutions together with communities, because just like we have seen from Calvin's presentation, that this would be important to make sure that you are addressing the real concerns of the community and that the impact that you're creating can be sustained in those communities. And then also the issue of One Health, utilizing One Health approaches in addressing community challenges. This has also come out so clearly from the deliberations from Florence. And especially the examples that you gave, Florence, were very, very helpful in bringing this to perspective.